Hey everyone, my name is Erin and I'm a physical therapist, and I'm going to start a little mini series where I come on at least once a week and kind of talk about common complaints and ailments that people come to physical therapy for, and then hopefully give you some corrective exercises to help with those ailments. By no means is this going to be a fix-all for everyone's issues, and please, if you have any questions or concerns about the videos that I post, just shoot me a message and I'll be more than happy to help you out. So the first topic that I want to address is low back pain. Research shows that approximately 50% of patients that come in to outpatient physical therapy have low back pain. And I mean, that number is just so high, and I just feel like it's super preventable. When you come in as a patient for low back pain, there's just so many different signs and symptoms that you can present with that we as physical therapists, in order to help you, we have to put you in a certain category, and that category helps us figure out which management strategy is best for your signs and symptoms. And so one of the categories that I'm going to talk about is the stabilization category. And all that means is that you just need a little extra core stabilization to help alleviate some of that stress that you're putting on your low back. One of the best things though that you can do for low back pain is just general active exercise. And then on top of that general active exercise, we can add in some core strengthening components to really hone in and really help you with that low back stability. And so today I'm going to talk about just two muscle groups that we can help try to focus on and help strengthen and give you more stability. The first muscle group is called your transverse abdominis. It is a deep muscle that runs in your lower abdominals, and it actually kind of acts as a built-in back brace. It really helps you stabilize all around your core, but especially your low back. And then the second group is called your lumbar multifidus, and it's a larger muscle that runs, it kind of attaches from spinal segment to spinal segment and just really helps stabilize the spine. So now that I've kind of talked about two different muscle groups that we can address, I'm going to show you a couple exercises that you can start doing at home in hopes to alleviate some of that low back pain. This first exercise is going to help target your transverse abdominis. Remember, that's the built-in back brace that we have in our lower abdominals. So what you're going to do is you're just going to simply lie on your back with your knees bent, and I'll show you in a second, and you're going to find your hip bones. And then once you find your hip bones, you're going to come a little bit in off the bony area of your hip bones, and the simple movement is you're literally going to try to pull your belly button towards your spine. And so you're kind of bringing your pelvis, which is like this, and you're going to be kind of bringing it back, and so that your belly button, you're trying to pull your belly button into your spine. Now it's not like you're like sucking in, you're not sucking in trying to hollow out your stomach, you're like bracing, you're like kind of bearing down. And under that, when you do that little tilt, you'll feel those muscles kind of pop into your fingers. So you want to make sure that your back is staying completely flat against the floor when you're doing this, and you're going to hold it for maybe 3 to 5 seconds and then relax and then do it again. And for this next one, which is going to target that lumbar multifidus, you're going to lay on your back again with one knee bent and the other one straight. The bent leg is going to have your foot on either like a towel roll or a pillow, just whatever. It needs to be propped up on something. And all you're going to do is try to tighten your abs and gently press into that pillow or towel. Press your heel into the pillow towel as if you were trying to push your foot away from you. I'll show you this. It's a little trickier than the first one, but so you're going to push in as if you're like sliding your heel out, but you're not really sliding your heel out. You're going to hold that for a couple of seconds and then relax and repeat. So I'm lying on my back, my knees are bent. I'm going to find those hip bones, and I'm going to move in maybe like a ½ inch from those. So you don't want to be on your bones. And all you're going to do is you're going to remember, try to push your belly button into your spine, and so you're naturally going to rotate your hips in that backwards motion. So here it is again, finding those hip bones, coming in medially, and I'm going to try to push my belly button to my spine. And so I start, and I have a space where I can fit my hand under my low back, and when I bear down or brace, there's no more space. So that's what you should be feeling. And you'll feel that muscle pop out into your hands. The second one is where you need your pillow or your towel under your foot. Whichever foot is on the pillow or towel, the other one is straight. You're going to, once again, tighten that core, and you're going to push your heel as if you're going to slide the towel or pillow out. Now you're not going to slide it out. So here that is again. You're going to tighten your core and try to push, and you'll feel that contraction in your low back. If you have any questions on those exercises or anything that I talked about today, like I said, please feel free to message me and I'll be happy to answer.